Garlic has long been revered as a natural remedy for infections, and modern science supports its reputation as a powerful antimicrobial agent. The compound allicin, which forms when garlic is crushed or chopped, is largely responsible for its antibiotic-like effects. Studies have demonstrated that garlic can inhibit a wide range of pathogens, including bacteria, fungi, viruses, and even some parasites. But while garlic shows real promise in this regard, it's important to approach its use with both optimism and caution. Against bacteria, garlic is especially potent. Research has found that allicin can kill or suppress the growth of common pathogens such as Escherichia coli, Salmonella, Helicobacter pylori, and even antibiotic-resistant strains like MRSA, methicillin-resistant Staphylococcus aureus. It works by penetrating bacterial cell membranes and disrupting key enzyme systems, ultimately stopping their ability to replicate and spread. However, garlic's antibacterial effects are not as fast or targeted as pharmaceutical antibiotics, and its potency can vary significantly depending on how the garlic is prepared, stored, and consumed. Garlic is also known to combat fungal infections, including Candida albicans, the yeast responsible for oral and vaginal thrush, and some forms of digestive imbalance. Allicin and related sulfur compounds in garlic can inhibit fungal growth and disrupt fungal biofilms, making it a potential adjunct in managing persistent yeast issues. That said, chronic fungal infections still often require medical intervention, and garlic should be considered a supportive therapy, not a cure-all. When it comes to viruses, garlic appears to stimulate immune function more than directly attacking viruses. Compounds in garlic may enhance the activity of immune cells like macrophages and natural killer cells, improving the body's ability to defend itself. Some laboratory studies suggest antiviral activity against viruses like influenza and herpes, but human data remain limited. Garlic may help reduce the frequency or severity of viral infections, particularly in the respiratory tract, but it cannot replace antiviral drugs in serious conditions. One of garlic's greatest strengths lies in its broad-spectrum activity. Unlike conventional antibiotics, which target specific bacteria, garlic can disrupt many types of microbes at once. This makes it especially valuable in preventive use or during early, mild stages of infection. However, it is not a replacement for prescription antibiotics in moderate to severe bacterial infections such as pneumonia, sepsis, or urinary tract infections. Delaying medical treatment in such cases by relying solely on garlic can result in serious complications. There are also limitations and risks. Allicin is highly unstable and breaks down quickly. Cooking garlic destroys much of it, while even raw garlic can lose potency if not consumed soon after crushing. Digestive irritation, allergic reactions, and interactions with blood thinners or HIV medications are other concerns. Moreover, while garlic may reduce the risk of antibiotic resistance by offering a natural alternative in mild cases, overuse or misuse in place of real treatment may lead to harm. In conclusion, garlic is a genuinely effective natural antimicrobial with the abilities to support the body's defenses against a range of infections. It shines as a preventive measure and mild adjunct therapy, especially when used raw and regularly. But it should never be seen as a substitute for professional medical care when facing a serious infection. The best approach is an informed one. Respect garlic's power, understand its limits, and use it as part of a broader, evidence-based approach to wellness.